Hello there, guys. Today in this episode, I will be doing a presentation about the three diabetic tests that we normally do to be able to diagnose you as having normal blood sugars, pre-diabetic, or diabetic. So, if you have the three normal tests that we'll normally do, one, we have the fasting blood sugar test, we have the random blood sugar test, and we also have the HBA1C. So for the fasting blood sugar test, or something also called as FBS, it's normally done in the morning, ideally before you have had anything to eat for at least 8 hours. And we assume that when you went to bed, you never had anything while you were asleep to eat. Because if you had anything, that will not be considered a fasting blood sugar test if it's below 8 hours. Then we also assume that you never had breakfast in the morning, so you are basically going in and doing this test having had nothing to eat for at least 8 hours. And it's normally a range that will place you if you're having normal blood sugars, if you are pre-diabetic, and if you are diabetic. The second test which I talked about is called the random blood sugar test. So for the random blood sugar test, it's normally done 2 hours after you have had your last meal. And these 2 hours after you have had your last meal, we are assuming that your insulin function has been able to be able to start leveling back the sugars back to normal. Okay, so for within 2 hours after you have had your last meal, your sugars will always be high. But if you have a normal insulin function, they should start be plummeting after 2 hours. So it's normally done 2 hours after you have had your last meal. Then you have the HBA1C, which is considered the benchmark for all the diabetes, for diagnosing diabetes. Reason being is that it gives you a good range of how your sugars have been in your blood for 2 to 3 months. So this will not be affected if you fail to eat one day, because for example the fasting blood sugar test, if you fail to eat the whole of yesterday or just eat a single meal, a very light meal, and then you wake up in the morning to do it, it might not give a precise results of what has been happening in your body. Well, for the random blood sugar test, if you eat something very light and very low in carbs, we might also not give you a good representation of what's going on in your blood. So the HbA1c is the gold standard for being able to diagnose diabetes, because it gives us a 2 to 3 months range of how your sugars have been in your blood. So which are the normal ranges? For the fasting blood sugar test, the normal range is anything below 5.6, while pre-diabetes it's between 5.6 to 7 mmol per liter, and for diabetes it's anything above 7 mmol per liter. I'll repeat that again. For the fasting blood sugar test, what is considered normal, it's anything below 5.6 mmol per liter, while for the pre-diabetes it's anything between 5.6 to 7 mmol per liter, while diabetes is anything above 7 mmol per liter. For the random blood sugar test, normal is considered to be below 7.8 mmol per liter, while for the pre-diabetes it's between 7.8 to 11 mmol per liter, and diabetes anything above 11 mmol per liter. So you can see it's a bit higher than the random blood sugar, than the fasting blood sugars, because this is only a 2-hour window that you are giving it for your sugars to go back to normal. So for the HbA1c, anything below 5.6% or 5.6 itself is considered as normal. However, between 5.7 to 6.4%, you are considered to be having pre-diabetes, while from 6.5% and above, you are diabetic. So like I said, HbA1c is the gold standard for being able to diagnose you as having diabetes. So if you are, these are the risk factors. If you are if you have these risk factors, one, you are above 50 years old, and this applies both to men and women. One reason it applies to women is because you are at menopause, and at menopause you still do not have the protective benefits of estrogen, so you are at risk of diabetes. For men, your testosterone is a bit low, which was a bit enhancing your function to be able to counteract high blood sugars. It's a protective mechanism. Then if you are having a family history of diabetes, you have relatives who have diabetes, that's another reason why you should take this test. And then the other reason is because you have had a long history of consuming probably an unhealthy diet. For example, a diet that is very rich in processed foods like snacks, which include the processed carbs. You have, let's say you have had this history for more than 20 years. You're supposed to take this test because it will be able to diagnose if whether you still have a normal insulin functioning. So thank you guys for watching this video and hope it blessed you.